Well, everyone, thank you for joining us. We're going to get started in just 2 more minutes. Again, if you have any questions as we move forward, please feel free to drop those into the chat. This will be accessible as a recording on our Facebook, which is at MHA Hawaii, but we'll also be sending you a link in your post attendee email. If you are putting any information in the chat, just know that it's confidential, even in the recording itself, that it will not be viewable within the recorded section. Aloha, everyone, and happy Aloha Friday for a really long weekend. You can tell I'm super excited about that. My name is Dr. Misty Sagas. I am the program director here at Mental Health America Hawaii, and I'm very, very excited to welcome all the people we have participating today who are joining us from the Child and Adolescent Mental Health Division. I'd like to give a big round of applause to have you guys here. I used to do direct service, and I had a lot of interaction with CAMHD, and I'm just really excited for everyone to be able to learn more about the services they provide, and they just do so much for supporting our families here on the island and throughout the state. So without further ado, I'd like to welcome Trina Oramoto. She is the PICO manager. She works for the Program Improvement and Communications Office, and she is their clinical psychologist. And she'll be walking us through our webinar today.
Thanks so much. Thank you, Mental Health America, for facilitating this too. We're so excited to be here and to be here with all of you guys. Now more than ever, it's really important for families to talk about the mental health of local children and youth. And the Child and Adolescent Mental Health Division, which is part of the Behavioral Health Administration and the Department of Health, is a resource in the community that does just that. Today, I'm joined by two fabulous members of our staff who will be answering a number of really basic questions about what we do, how to access our services, and all of the nitty-gritty that you might want to know. We want to make sure to answer any questions that you have, so please feel free to drop them in the chat and we'll keep an eye on that. So without further ado, I'll let them introduce themselves. Kurt, if I can start with you.
Okay, hi everybody. My name is Kurt Humphrey. I am the medical director for the Child and Adolescent Mental Health Division, and I am a child and adolescent psychiatrist by training, and it's wonderful to be here. And Keli?
Thanks, Kurt. Hi, everyone. I'm Keli Acquaro, and I'm the Neighbor Island Services Branch Chief for the Child and Adolescent Mental Health Division, which basically means that I oversee the family guidance centers that are on the neighbor islands. I've worked for CAMHD for about 23 years, and I'm really excited to be here today. So thanks for having us.
We thought we would set up our time in a little bit of a question answer type format and thought through what type of questions folks in the audience might want to know about the CAMHD. So to start us off, I wanted to ask Kurt and Keli, why is it so important for people to be talking about children's mental health right now, right in this moment?
I'll kick things off. First, I have to say it is a total pleasure and privilege to be able to do, talks like this and kind of reach out to community, and, so thankful for everyone joining this webinar. And part of the reason why I'm so thankful is it is super important to get the message out there that we need to be aware of children's mental health. It's become even more of an important need of focus because of all of the stress that we've been under throughout the pandemic, the social isolation, the school challenges, health challenges, economic challenges for everyone. All those things don't just affect adults, they affect all of us, including kids. And so we gotta pay close attention to the mental health of our kids. that's one of the main reasons why we really feel like it's important to bring you this message.
Yeah, absolutely. And I think, kind of one of the things we're going to be talking about probably throughout our short time today is just how mental health, physical health, I mean, these are all parts of the human condition for kids, for adults. Globally, we're going through a stressful time, and we should be acknowledging that and talking about it and helping each other and modeling for our young people that part of taking care of your health is taking care of your mental health, that mental health is a real thing, and that staying connected to people and talking to people you care about and trust is a really good good start for taking care of your mental health. And, I think as things start to lift with COVID and things like that, there might be a sense that, oh, it's over. The stress is over, like we don't have to talk about this anymore. I think a lot of people are ready to move on, but I think what we know is that we're probably going to be seeing some mental health effects from the pandemic and from the shutdown and from the isolation for a while to come. And so now more than ever, I think it's important to make sure that children's mental health stays on the radar.
Keli, sticking with, oh, go ahead, Kurt.
Sorry, I just noticed in the chat someone asked if anyone had a mental disability. So I just wanted to maybe address that in that, part of the message that we want to bring is destigmatizing mental health challenges. And so I want to kind of bust the myth that there's a dividing line between a mental health consumer and a mental health provider. Everybody, including everybody on the panel and all the participants listening today and all the kids out there, have to pay attention to mental health because it's just as important as taking care of our physical health. And so it's really not anything where there's a dividing line. And so I'm not going to answer that, question directly, but I just wanted to answer it in that way that, we all have to practice good mental health. It's important for, total well-being.
Sure. And also for you, thank you for saying that, Kurt. And also for young people, I think sometimes it can be hard to understand, just like with your physical health, you might be someone who's a generally healthy person, but every once in a while you get sick. And sometimes you get really sick and you take care of it and you get better. And we really shouldn't be thinking about mental health and physical health so differently like we have historically, like you're either mentally unwell or you're not. It's part of the human condition and it's part of a continuum. And sometimes you're going to be in pretty good health and other times you're going to need some help taking better care of your health. And it's important to hold that that way and know that that's true and have it be a more normal part of life.
Thank you both so much. I guess circling back a little bit to talking about the CAMHD, Keli, tell us a little bit about what the CAMHD is.
Sure. So for folks who aren't familiar with us, we are part of the Hawaii State Department of Health. We offer free voluntary mental health services to kids who qualify. We have a website that you are welcome to check out that Trina has dropped in the chat, I think. And we have community health centers for children and adolescents throughout the state. So we have 3 on the island of Oahu, and we have centers on Kauai, Maui, and 2 on the Big Island. And really, we're here to be a resource. We are a carve out of MedQuest. We provide behavioral health services for MedQuest and really want to identify and help as many kids as we can. And we also really believe in being super inclusive. And so we provide services to anyone who qualifies. We do not discriminate. We try to make a welcome environment for all comers.
And along those lines, Kurt, can you weigh in a little bit to tell us who you serve at the CAMHD?
Absolutely. So I'm not going to go into the minutia and the great detail about it, but really simply put, for for entry into CAMHD, you do have to meet some basic eligibility criteria. CAMHD services are fairly intensive and different from community services at large. And so we do really want to make sure that we're treating the right types of people for the right reasons. You do have to have a diagnosed mental health condition that impairs your daily functioning in moderate to severe range. We serve kids as young as 3, teenagers, and young adults up to age 20. And you do need to have MedQuest Medicaid insurance to be eligible for these services. And as far as the functioning, impairment and functioning criteria, there is kind of a rating scale metric that we use to check that, and it checks to see how kids are functioning in various settings, like at home or at school or in the community. So it takes into account a lot of different environments to see if there's impairment in any of those places. And in terms of what is or is not a mental health diagnosis, for CAMHD purposes, we don't include substance abuse disorders or developmental disabilities as primary qualifying mental health disorders.
Now, if I'm a parent of a young person, or if I'm a young person, 14 years and older, how would I know when it's appropriate to reach out to you guys for help?
That is a great question. And there are a lot of nuances to that, but what I would say is that we all face stress in our daily life and our daily living. And so some amount of anxiety or, difficulty coping is normal and expected and appropriate. And so if troubles for kids are kind of mild, if they're limited to just a few bad days or maybe a bad week, if things are not progressively deteriorating and becoming severe, it might be more appropriate to talk with like a primary care provider or an outpatient therapist that but if things are lasting a long time, not getting better, or if it's getting worse, if things are kind of getting moderate to severely challenging, then thinking about applying to CAMHD is a great idea. And so some things that you might think about as sort of warning signs that your kid might need more help is if they're having such trouble at school that they're being suspended or frequently truant from school, or if they're running away from home. Those could be signs that kids are struggling more and need more help. If there's significant changes in eating habits, if there's any talking about suicide or death, those are big warning signs that something serious is wrong. Being angry, aggressive, irritable, starting to use drugs or alcohol, even attentional problems are a cause for concern sometimes and might need to be brought up to the attention of CAMHD. Physical fights, excessive fearfulness or worry, any kind of conduct problems like stealing, those types of things would be enough cause for concern that you might want to seek out CAMHD support. And of course, if anything is clearly imminently dangerous, if you're worried that your child could harm themselves or someone else, definitely don't delay, call 911 or go to the nearest emergency room. And kind of above all else, if you're worried, just go ahead and apply for CAMHD services. Our intake coordinators will kind of help you figure out what services are right for you and your family, and can get you on the right path. So definitely, if there's any worry at all, we'd rather you err on the side of applying.
Thanks, Kurt. I guess if I was a parent or a young person, is it okay for me to make a referral, or do I have to go through my school, or what's the best way to make a referral to you all?
So anyone can make a referral to CAMHD for a youth, but of course we won't screen a young person without parental consent. The exception to that is there was a law passed recently that allows 14-year-olds and older to access mental health services without parental consent. And so if they meet with a mental health professional and the professional agrees that they understand that they can make that decision and that it's would serve them to receive services without parental consent, then they are allowed to do that. But generally speaking, if you're a friend of the family, if you work with the child at school, you're just someone who's concerned about a young person, you can absolutely make a referral on their behalf. And I would just say that please talk to the parent about your referral so that when we call them to follow up to see if it's something that they give their permission for us to continue with the screening, it's something that they're expecting and know has happened. But yeah, anyone can make a referral. And if you go to our website, you'll see there's numbers for all the family guidance centers throughout the state. And you can just call, our application is on the website. Thank you, Trina. Here's what our application looks like. The first 2 pages is what a parent would fill out. It's just demographic information and your signature giving permission to for us to screen. We see if there's anyone who's already working with your child that we might need your permission to talk to so that we can get better information for the screening. And that's about it. And then there's another page that if you're working for a agency and you're making the referral for the child, then there's another page for you to fill out as a professional and as a contact. But yes, as Kurt said, we're interested in helping as many kids as we can. So if you're worried about someone, anyone can make a referral with parental consent to screen.
Now, I know it takes a lot of courage to make that first phone call. So I guess, Kurt, if you could tell our audience a little bit about what they might expect when they make a referral and call you all.
We want to stress that we really value the input from the family, and we want to make sure that we're taking in any information that the family can share, other providers can share, and that we're really making sure that we're providing the services that are needed and what the family is looking for, and something that's going to meet their treatment goals and their expectations for helping their kid get better. So it's really a dialogue and something that we kind of pride ourselves on being really family and youth focused, and not dictating to people what services they're going to get. So yeah, expect that you'll have a conversation with an intake coordinator, and a lot of questions are going to be asked, but we're just trying to get the information that we need to make good recommendations and good decisions as far as, starting care. And if needed, we might ask for your child to have a mental health evaluation if there's more, just information that we need to collect to kind of get services going and on the right path. And do know that a CAMHD clinician who is either a licensed psychologist or psychiatrist will be making the eligibility determination and overseeing the care of your kid.
So if my family or my young person is made eligible by the CAMHD, how are services delivered, Keli, and what can I expect?
Well, like Kurt mentioned, we do try to be very youth and family oriented, and we do use a team approach and we use a coordinated services approach. And so what that will look like is, if your child is found eligible, the very first thing that would happen is that the person who's going to be your care coordinator will call you up to introduce themselves and to invite you to a welcome meeting. And that welcome meeting is our opportunity to get to know each other better, to let you know what this is going to look like, your journey through CAMHD, to get a sense of what your goals are, and to make sure that you understand the mental health evaluation that was completed and the treatment recommendations that are being made. And so it's a time for us to collaborate and talk about what we want to achieve and what we think the best strategy will be to achieve our goals. And that kind of team approach and shared decision-making approach is what we will do throughout the course of CAMHD. And so we will identify any important stakeholders that are working with your child. We will pull everybody together, and we'll make sure that, anyone who's trying to help this child, that we all know what each other is doing, that we're not working at cross purposes, that we're not doing redundant things, and that we're all on the same page and working towards the same goals. And so throughout the care, even if, the particular treatment changes or we make different decisions, those will all be team-based decisions that we make together. And, we've been getting better at providing services via telehealth. And we've been doing that a lot for people's safety and convenience. And we still will be able to do that moving into the future. And so we really try to make sure that services are delivered in the most natural setting possible, and that any barriers to receiving services are taken care of so that kids and families can get what they need.
Thanks, Keli. Kurt, tell us a little bit about the types of services that the CAMHD offers.
Keli brought up the care coordinators, and I'm glad she did. They're really the backbone of CAMHD services. The care coordinators provide an important role managing services, helping make sure that the services are in alignment with what the clinical lead who's overseeing care is recommending. They're system navigators and your go-to people, your main point of contact. And so that care coordination service is really an important part of what we do. Our CAMHD clinical leads, the psychiatrists and psychologists, do direct services with kids and families, but the vast majority of what CAMHD offers is provided through our contracted providers and private providers. So there's a super wide array of services that fall in that category. And we're really proud that there's a large range of things that people can access depending on what their needs are. So we have intensive in-home therapy, transitional family homes, crisis services, residential programs, independent living skills, hospital-based services, parent and youth partners, and a couple of services that are really special to us is our evidence-based programs, which are called multi-systemic therapy and functional family therapy. And these programs are, proven effective treatments for kids with certain symptoms and disorders. And, we're really proud to have these as part of our service array because we really rely on them to provide an excellent high standard of care for certain individuals that qualify for those services. So.
And how long, Keli, might I expect services to last?
Well, treatment is really individualized, and decisions about the length of treatment are based on data. And so when a child is being served by CAMHD, we have kind of 3 legs to the stool that helps us determine how a child is progressing. So we use something called the Ohio scales, which is the youth and parents' opportunity to tell us how they feel like they're doing. We have the child and adolescent functional assessment scale, and the care coordinator completes to say how they see the child doing from their point of view. And then the treating provider, the therapist, also completes an outcome rating in terms of how they think the child is doing. And so we have all this data to let us know if the child is making progress, if they're meeting their clinical goals, and if they're getting ready for discharge out of the CAMHD system. And so we are really mindful because more services aren't always better. In fact, we have a lot of data to suggest that kids can reach a point of diminishing returns. And so we're really careful to monitor closely how kids are doing and discharge them when the time is right. But it's an individualized decision. A more global answer, I guess, and maybe the simpler answer is that our data indicates that most kids' length of stay with CAMHD is anywhere from about 9 months to a year.
Now, Kurt, you mentioned earlier that not everybody will need the intensive services that CAMHD provides. So what are other resources that you recommend folks in the community check out if they just want a little more information or a little more support on mental health for their children, youth, and families?
Well, I would be totally remiss if I didn't shout out Mental Health America Hawaii. They're a fantastic resource, our host for this meeting. They have an amazing website for you to check out. So that is definitely one place we would encourage folks to go. I also want to highlight the Help Your Keiki website. This is a website that CAMHD kind of curates in collaboration with partners with the DOE and community providers, and is part of our evidence-based services committee kind of outreach. So that's a great place where we share helpful resources and things that we know are helpful and not harmful to kids who need mental health support. So that's at helpyourkeiki.com, and it's on your screen now. That's a fantastic website. We want people to know about Hawaii Cares Line at 808-832-3100. That's a resource that you can call to get kind of pointed in the right direction to get services started for your kid. The crisis text line is also available for folks who are experiencing a crisis in the moment. You just text the word aloha to 741-741 and somebody gets on the line and texts right back with you. So that's a great resource. We also want to point people to their schools and their primary care doctors, and just going through the exercise of kind of looking through your local community resources and looking to see what providers in your area provide services is, a helpful thing that you can kind of familiarize yourself with. So.
Thank you both so much for your time and expertise in this area. I noticed that we're right at 12:30, but I wanted to make sure that we left some time to answer questions. So for folks who need to jump, that's totally fine. But maybe we can go to the chat. So there's a question from someone asking, adolescents with private insurance is not eligible for CAMHD services, question mark?
So right now, the only kids that we serve who have private insurance are kids who attend public school and have individualized education plans. They're in special education, and their school team has identified that they need mental health services in order to get their free and appropriate public education. And so if there's a child in public school who has an IEP and they have mental health concerns, and that IEP team feels like they need our supports and services in order for the child to get their education, then they can also make a referral to CAMHD, and we serve those kids as well, regardless of their insurance. But besides that category, we serve kids who have Quest insurance.
Another question was, kids 11 years old talking about driving a car would be a mental health concern, question mark?
I'm going to say not necessarily. Kids talk about a lot of things, and sometimes they're kind of talking through what they want to do or what they fantasize about, but they're not necessarily going to get into the car and drive the car. So it really depends on what that talk is about, and what about the kid and what they're capable of doing. And so I would have to say really case by case on that one.
Thanks. And there's another question about, is the youngest age of self-referral 14 years old? I can tackle this one. So Keli mentioned there was a law that was passed recently that allows youth ages 14 years and older to seek out their own mental health services without parental consent. This only applies to outpatient. It doesn't apply to residential or medication. So we do try to accommodate any young person that does reach out to us if they're 14 years or older. There are a number of different criteria to make sure that we feel confident that they're mature enough to be able to make this decision on their own. But that's certainly something we want to honor, particularly because we know how much effort and courage it takes for young people to reach out. I think those were the main questions. Oh, there's some in the Q&A. If the child doesn't have insurance, will CAMHD work with them to get registered for Quest if they meet all of the other eligibility requirements?
So one of the things our intake coordinators do when a family calls to apply their child for the services is they will ask those questions, right? Does your child have Quest insurance? Are they, do they have an IEP at a public school? And sometimes, every once in a while, there are even other funding sources that, an intake coordinator might know of in the area that might help. So one of the things that they do is try to hook up the family with an appropriate funding source for our services if the family doesn't have one. They can't do the application for the family, but they can try to make sure that they know about all the resources and help them through the process.
And the last question is, if the youth is 14 and up and wanting to receive services without parental consent, is there a separate application or referral form? They would actually be completing the same application, and they also have to fill out an additional form. But I would say that if they call our office, people would be more than happy to help them navigate that process. And the form can look a little bit long for some folks. And I would say that's the case for anybody. If they need some help, call our office. We'll be happy to help out with that. So given the time, we're a little over. Oh, sorry, there's one more question. Can you please share again about the substance use not being a qualifying diagnosis?
Okay, I think that was something that I mentioned. And just to clarify that a little bit more, so youth can have co-occurring substance abuse disorders and qualify for CAMHD. But for CAMHD eligibility, that can't be the primary or the only diagnosis that the youth is struggling with. So, we would refer to community providers or perhaps the Alcohol and Drug Abuse Division for youth that are struggling with substance use problems alone.
Thanks, Kurt. I wanted to round out our time with one final question for our excellent panelists, but I also wanted to point people to our Facebook and social media Instagram handles, which is at CAMHD Hawaii. So please check us out, follow us on both of those places. We try to post a lot of resources there and are a little more live in our interaction with the community in that way. But final question for our great panelists, what is one thing that you would want to tell a young person who might be struggling with mental health concerns right now? If they were sitting in your office or right next to you, what would you tell them? I'll start with Kurt.
I would probably focus on just really encouraging and praising that person who's reaching out to keep talking and to keep reaching out, because talking about mental health challenges, we know, isn't easy. It should be a lot easier than it is, and hopefully CAMHD makes it a little bit easier to reach out and talk about mental health challenges. But we know that it's not an easy thing to be vulnerable and kind of put yourself out there and ask for help sometimes. But help is available. Mental health treatments do work. And it's not as scary of a process to go through to talk to a therapist or a counselor as some people might expect. So, really just encouraging, people to do reach out and take care of themselves and do what they need to do to feel better, because there's no reason to suffer and to feel badly when there are treatments out there that really do work and really do help people. And not going to go into my personal story a lot, but maybe people can see on my screen. Oh, I'm pointing the wrong way. I do see my own therapist regularly. I'm a big proponent of, mental health, both as a provider and as a consumer. So yeah, I can't say enough how important it is to take care of your mental health and reach out and get that help that you need. So that's my 2 cents.
Yeah, absolutely. I mean, I think that's the key. Is it's so important to just talk to someone that you trust and that cares about you. And just that simple act of reaching out and talking to someone most of the time provides so much relief and connection, and just getting out of that feeling of being isolated. And like we were talking about earlier, this is just part of the human condition. There is nothing wrong with struggling. You can reach out for help. There's tons of help out there. And, sometimes when you talk to other people about your feelings and what you're going through, you're helping yourself and you're helping the other person, because now that other person knows that if they're struggling and want to talk about their feelings, you're someone who can do that. And so you're kind of being an ambassador for mental health in the world, to use Ms. Disa's title.
Thank you both so much for your time today. And we appreciate all of you for joining us too. We hope that this was a helpful time for all of you and for the community. Ms. Disa, is there anything else we need to do to close out?
That's all. Just wanted to thank everyone for coming today. You will be receiving an email probably late this afternoon that's going to have a link to the recording so you can watch it and share it as needed, or you can head over to our Facebook page where it's already there and streaming live and will be available for everyone. But thank you so much for joining us today. I hope everyone has a fantastic long weekend and do some self-care if you can find those 5 minutes.
Thank
Thanks,
you so
everybody.
much. Bye.